welcome back. Now, we've been talking about poison awareness. We're here with Dr. Lopez. And now we're going to talk about some other things that you, as a viewer, may need to be aware of when dealing with poison. Now, Dr. Lopez, what are some precautions that our viewers can take to prevent unintentional poisoning?
Right. One of the highlights that we like to promote, especially when someone gets into a product or a chemical, is number one, make sure they know the label directions in terms of, using the product, storing the product. In fact, storing is a key element because we'd like to tell people after you've done your thing with the product, taking it, using it, cleaning with it, make sure you put it back in its place. Leaving things exposed so that other people can get into it is a big no-no. In fact, after you finish using whatever product it is, make sure you put it back.
Okay.
Another big safety tip, especially when it comes to medicines, and you'll see this even in non-medicines, but with medicines, make sure you put on the safety cap.
Right.
We often refer them as child-resistant caps. When you go to the pharmacy, get your prescription filled.
Correct.
You know what I call those? I actually call those adult-resistant caps. and the reason being is that kids are pretty ingenious. Yes. They can figure out how to open just about anything.
I have a 5-year-old nephew, and I have seen that firsthand, and you'd be wondering, how in the world were they able to do that?
Right, because you and I, we can't open it, but those kids can. They're pretty ingenious. So when someone puts gives you a prescription, and they put a child-resistant enclosure, make sure you put it back on, number one. Make sure you put it on and you affix it properly. Because what good is a child-resistant enclosure if it's not put on properly?
Correct.
And that doesn't apply just to drugs. It also, if you think about the chemicals that are around our homes, mouthwash, cleaners, they all have safety enclosures. So you've got to make sure you affix it tightly. I know of a case that I had a number of years ago where a mom didn't do that, and it was with the classic poison, and all I have to say is one word, and you know exactly what happened to the kid. And the poison that kid got into was Drano.
Wow.
So you don't even have to go any further about what you think might have happened to that kid.
Yes.
And it was all because it was improperly stored and they did not put the safety cap back on.
Okay.
So that's a huge safety tip. And then of course the easy one is make sure you know your local resources. And of course we'd like to be at the top of that list. A lot of people will think they'll call 911. That's fine. But 911 can't answer those kind of questions immediately. So if you're trying to avoid any delay in getting some information, make sure you have that number to your local poison center. Because in Georgia, at least, we're the only game in town.
Right.
But if you happen to move to another state, make sure you know who to call in the event of emergency. Because poison centers like me and all around us are open 24/7.
Right.
So you'll always be able to get accurate information.
Okay.
And we like to say, get a sticker from your local poison center. Get a magnet from your local poison center. Know where, put it in your speed dial. Those are the kind of safety tips we like to give to people who are accessing our service for the first time. And interestingly enough, new to all this in terms of knowing your poison center is we now have on the web a way for you to communicate to us via live chat.
Wow, okay, good.
You can get online at our website, which is www.georgiapoisoncenter, all spelled out, all one word, .org. So georgiapoisoncenter.org, you click on the live chat now, and you will interact with one of our doctors, nurses, or pharmacists, and they can immediately help you with a poisoning emergency.
Wow, what would we do without technology today such as that?
It's a great new feature. In fact, we are the first poison center in the country to do live chat.
Okay, good deal. And of course that, right here in Georgia, that just lets us know that we have all sorts of resources here that is beneficial to the people here in Georgia and of course the visitors that are here in Georgia. And we need to take advantage of them and utilize these resources because, a lot of times, depending on where you are in your state, you may not know what resources are available to you, and this is one way that we're trying to, use the media so that we can let them know that, hey, Georgia Poison Control Center is here for you. They have all sorts of resources available for you to try to interact with them, and that's very, very important.
Right. In fact, we had a customer, a patient who accessed our live chat, who's from Georgia, was vacationing back in the Midwest, did not know the poison center in the Midwest that they were at, but they knew that we had a service live chat. So what did they do? From the Midwest, they live chatted with us, but they live here in Georgia.
Wow, that's great. Hey, can't beat the new media technology today.
You cannot.
Now, you talked about chemicals. Now, let's talk about chemicals where, let's say, I'll give you a prime example. If someone has one chemical that has always been labeled, always in its container, and for some reason the label comes off and they store it away, and someone else comes up and not know exactly what that particular chemical is, don't know how it reacts. Kind of talk about putting chemicals in different types of containers without labels on them.
Yeah, very dangerous. In fact, one prime safety tip is keeping products in their original container. There's a phenomenon that we call in our business called the look-alike phenomenon.
Okay.
And let's take a chemical, for example, like windshield wiper fluid.
Okay.
Very commonly found. You can go to your local grocery store, convenience store, big box store, and buy a bottle of windshield wiper fluid for about $1 or $2, right?
Right.
Most of us use that windshield wiper fluid that's blue in color, and that can be mistaken because of its color for a product that may be safe. For example, blue windshield wiper fluid and blue sports drinks.
Right.
If you pour that windshield wiper fluid into a glass, and we've had this happen on a number of occasions, an unsuspecting child will come by and say, oh, that's that Gatorade. Oh, there's that blue Hawaiian punch drink.
Right.
Or here's that Mountain Dew blue. All of it's blue, and because it's out of its original container, all of a sudden you've got a poison. And in fact, when you look at windshield wiper fluid, I'm going to give you a very frightening fact.
Okay.
Think about a teaspoonful. Okay, 1 teaspoonful of windshield wiper fluid can cause permanent blindness.
Wow.
1 teaspoonful. So imagine a kid who thinks they're getting a Gatorade, getting Mountain Dew soda, they're getting a blue soda pop. They'll take a couple of swigs. That's at least 4 or 5 That's at least 4 or 5 teaspoonfuls. Incredibly dangerous.
Very, very dangerous and lethal.
And lethal. Another one very similar to that, also in our garage, oftentimes taken out of its original container, antifreeze. Yes. When you look at antifreeze, it's usually the fluorescent green.
Yes.
And what if that's out of its original container? Say again, in a pop bottle, in a glass, in a cup. An unsuspecting child comes along, or even not even a child. Say your spouse, or you might even been mistaken and think, oh, that's my lemon lime drink. An adult mouthful of antifreeze will shut down your kidneys.
That's scary.
That can also kill you. So taking things out of original containers, a bad thing. And that even applies to drugs. Most common that we see in our business is people taking drugs out of, say, their Tylenol bottle and putting it into another little drug dispenser or into another cup, and them saying, I remember I got to take that red and blue one, and I've got to take that white one at 3 o'clock, and then getting things mixed up,
right,
and then inadvertently taking the wrong medicine. Or, even worse, an unsuspecting child coming along, seeing a bunch of meds in not their original container, and then saying, look at these. These must be good to take.
Because they think it's candy.
And there's the look-alike idea coming back to life again, is people, especially unsuspecting children, getting into things that look like candy out of its original box, out of its original bottle, and now for easy consumption. Okay.
Now, and we've been talking about the preventive precautions to take. Now, let's talk about the situation when a poison does occur, and what precautions or what measures need to be taken at that point, and how critical it is to make sure that you get that taken care of in a timely manner.
Right. Everything's always time sensitive. You've got to try to find help as soon as possible. Now, for us, we'd like people to give us a call primarily. because we might be able to prevent that unnecessary ER visit, that unnecessary ambulance truck that comes by their house. This all saves time, saves money, and eventually lives. Right. So the first thing we want people to do, and I talked about this earlier, is know the number to your poison center. Okay. Once you call us, remain calm, because here's a great fact. 85% of all poison calls that we get require little or no treatment. So don't take a chance by thinking nothing's going to happen. Okay. Give us that call first. Now, when you call us, what kind of things are we going to be asking you? We're going to be asking you a lot of simple questions. We want you to remain calm. Call us first. We'll be asking things about your kid, especially if it's a 3 or 4-year-old. Their name, their age, their weight, their medical problems, the medicines they're on, a bunch of things like that. What symptoms they're having. Then we're going to be asking a few questions about the product. Do they have the product in front of them? Do they have a label? Can you give me active ingredients? Right. Most importantly, how much did they take and how long ago? Right. Then we'll try to get some contact information about them, like their phone number or their cell number, put them on a brief hold. We check our computer databases for the most current information and try to give that in a timely manner back to the caller.
Okay, and that's very important because, like you said, situations such as a poison, it has to be handled in a timely manner because, like you said, it's a life and death situation, and especially with children, because children are still developing, and when they have those kind of contaminants in their system starts to shut down fairly quick, and it's important to be able to identify that. Call someone as soon as possible and try to get help as soon as possible.
And that's a great point, because kids, based on their age and their body weight, can't handle the same kind of loads that adults like you or myself can handle.
Right, exactly. Well, Dr. Lopez, that has been a wealth of information today. I'm quite sure that our viewers will feel the same way and will take the necessary precautions, because we don't want anyone to get sick having the poison. But before we close, talk about potential suicides, where people take poisons and things of that nature. Real briefly, talk about that, because what are the call volumes for that, especially in this day and time?
Yeah, we get probably about 7 to 9% of our calls involve intentional suicides. Okay. And what are they overdosing on? Well, many of them are overdosing on their own medicines. Okay. A lot of them are on prescription drugs, antidepressants, antihypertensives, things for our blood pressure, and heart medicines. Those probably rank as some of the big ones. Another big one in there, pain medicines. Yes. A lot of our clientele will get into those things that are easily accessible without a prescription, like your aspirins, your ibuprofens, and your acetaminophen. Okay. Those products are very popular. So these calls are a little bit more sensitive, take a little bit more time, and hopefully if they get the right information in a timely manner, we can save their lives. Okay, good deal. And so we ask our audience to, if someone's in that situation, to identify it and get help immediately. Well, Dr. Lopez, we're about out of time. Well, we definitely appreciate you being on the show today. And before we leave, if you could give us that poison control number, that way if someone in the state needs to call that number, they can. But we also remind our viewers to make sure you check your local listing for the Poison Control Center there. In fact, it's a national number. Very easy to remember. It's an 800 number that started off with 222, then there's a 1 in the middle, and then 222. Okay, so it's 800-222-1222. You can call that anywhere in the country. You will get the local poison center when you dial that number. All right, we appreciate it. All right. We'd like to thank you for watching another segment of Smoke Signals, and we'll see you the next time.